Hello friends, let's discuss the physiology questions in your CBT 2. Let's look at the first question. The first question says the motility of cells is due to. This is a typical need pattern question, and this says motility of the cells is due to. Now motility of the cells is due to what are known as microtubules, right? And these microtubules in turn, this is because of microtubules, and the microtubules are made of proteins which are called tubulin. There are two types of tubulin. There is alpha and beta tubulin. So they are made of these microtubules. They are made of proteins called tubulin. So the answer to this question becomes tubulin, right? Tubulin. This is responsible for the motility. Let's have a look at the next question. This says, which of the following methods is not used for the measurement of body fluid volumes? Antipyrine for total body water? Yes. Inulin for ECF? Yes. Evans blue for plasma volume? Yes. I-125 albumin for blood volume? No. For blood volume, what is used is chromium labeled RBCs. Chromium labeled RBCs are going to be used for the measurement of blood volume. Radioactive iodine is used for the measurement of radioactive iodine labeled albumin. Radioactive iodine labeled albumin is used for the measurement of plasma volume. Radioactive iodine labeled albumin is used for the measurement of plasma volume. Now, what is the formula which is going to be used? This the usage of these substances for determination of different body fluid compartments. This is also known as the dye dilution technique, right? Dye dilution technique. And what is the formula which is used in this dye dilution technique? That is V is equal to Q minus E over C. V is equal to Q minus E over C. V is the volume which you have to determine. What is Q? Q is the known quantity of a suitable dye. Known quantity of a suitable dye which is used for the determination of that body fluid compartment. What is E? E is the amount of dye metabolized or excreted. Metabolized or excreted during the procedure. And what is C? C is the concentration of dye in a sample obtained after mixing has taken place, right? So this is the formula. V is equal to Q minus E over C. V is the volume to be determined. Q is the known quantity of a suitable dye which is used. E is the amount of dye metabolized or excreted, and C is the concentration of dye obtained in a sample obtained after mixing has taken place. Next, let's have a look at the next question. This says, at the end of isovolumetric relaxation, what is going to happen? Is it going to be atrioventricular valves will open or close? Now, at the end, remember, relaxation is a phase of filling. After the isovolumetric relaxation phase, the atrioventricular valves will open, and this will then result in the filling phase, right? At the end of isovolumetric contraction, the semilunar valve will open. At the end of the ejection phase, the semilunar valves will close. At the end of the isovolumetric relaxation phase, atrioventricular valves will open, and at the end of the filling phase, the atrioventricular valves will close. These will close at the end of the filling phase. Please remember, the opening and closure of valves depends on the pressure difference in the respective chambers. When the atrial pressure is higher than the ventricular pressure, the atrioventricular valve will open. When the ventricular pressure is higher than the atrial pressure, the atrioventricular valve will close. Let's have a look at the next question. This says that C waves in JVP is due to. You know that the JVP, this is JVP, this is seen on the right side. This is because the right internal jugular vein is in direct communication with the right atrium. There are multiple positive and negative waves. Remember, the JVP is better seen than felt. This is better seen than felt, and it has got multiple positive waves and multiple negative waves. Multiple positive and negative waves. Then there is a definite upper level which is going to be seen. This definite upper level is seen, and this level rises whenever you press on the liver, which is called the hepatojugular reflux. Now, what are these positive waves? Positive waves are A, C, and V, and there are two negative waves, which is the X descent and the Y descent. X and the Y descent. Now, out of these, what is the A wave due to? A wave is because of atrial contraction. What is C wave due to? C wave is due to bulging of the closed tricuspid valve into the right atrium during the isovolumetric contraction phase. And what is the V wave due to? V wave is due to the venous filling of the right atrium just before opening of the tricuspid valve. Right? So what is, like I said, the question says, what is the C wave due to? C wave is due to bulging of the closed tricuspid valve into the right atrium during isovolumetric contraction phase. During the isovolumetric contraction phase. Let's have a look at the next question. All of the following factors normally increase the length of the ventricular cardiac muscle fibers except. Now, anything which causes, please remember, the ventricular muscle fibers are circular. So anything which causes increased filling of the ventricle will increase the initial length of the ventricular muscle fibers. Now, what will cause an increase in the length of the ventricular muscle fibers? Increased venous tone? Yes, that means venous return will increase. Increased total blood volume? Yes. Increased negative thoracic pressure increases the venous return. Right? All of these will increase the venous return, which in turn increases the filling of the ventricles, which in turn increases the length of the ventricular muscle fibers. Lying to standing position. Let's see this here. What happens from the lying to standing position? The moment you take the standing position, there is going to be a fall in venous return because of a peripheral pooling of blood, and this will not cause an increase in the length of the ventricular muscle fiber. So my answer here becomes D. Let's have a look at the next question. Gastric secretion is increased by all except histamine? Yes. Acetylcholine? Yes. Histamine, you know there are H2 receptors present on the parietal cells of the stomach, right? Parietal cells of the stomach, the second messenger for these H2 receptors is cyclic AMP. Acetylcholine will act via M3 receptors and increases the intracellular calcium, which in turn will increase the HCl secretion. Gastrin, the receptors for gastrin will also increase the gastric acid secretion. Receptors for gastrin are the CCKB receptors. CCKB receptors on the parietal cells. Again, the second messenger is cyclic AMP. What does not increase the gastric acid secretion is HCl. HCl will in fact decrease the gastric acid secretion. HCl will decrease the gastric secretion. Right? So this is regarding gastric secretion. Next, which of the following statements regarding secretin is least correct? Which of the following statements regarding secretin is least correct? It inhibits gastric acid secretion. This is true. This is true. It increases bicarbonate-rich pancreatic secretion. Yes. Causes contraction of the pyloric sphincter. Yes. Increases gastric acid secretion. No. In fact, it decreases the gastric acid secretion. It decreases the gastric acid secretion. let's have a look at the next question. Which of the following sensory receptors is found in epidermis for determination of texture? Now, for texture, there are two receptors, that is the Merkel's discs and the Meissner's corpuscle. Now, how do we decide what is the answer which is going to be the best answer over here? See, the fact is, in the question, they have mentioned in the epidermis. And what is located in the epidermis? In the epidermis is the Merkel's disc. So the answer here becomes Merkel's disc. Meissner's corpuscles are located in the dermis, right? These are located in the dermis between the epidermal ridges. Right? So, like I said, if it was not specified which receptor is for texture, then my better answer is Meissner's. Right? If it is not specified, but because in the question it is specified what is found in the epidermis. In the epidermis, you have the Merkel's discs, right? Whereas in the Meissner's corpuscle is located in the dermis, right? So since it has been specifically mentioned which is the receptor for texture in the epidermis, my better answer becomes Merkel's discs. Next, let's see vestibular ocular reflex. Vestibular ocular reflex. What is vestibular ocular reflex? In vestibular ocular reflex, rotation of the head causes a rotatory movement of the head causes a compensatory movement of eyes. This is called the vestibular ocular reflex. There will be an inhibitory signal to the extraocular muscles of one side, and excitatory signals to the other. This results in a compensatory movement of the eye. This is called the vestibular ocular reflex, and this is related to the floccular nodular lobe. Floccular nodular lobe is the oldest part of the cerebellum. Why oldest? This was in terms of development. This floccular nodular lobe developed first, and it is the floccular nodular lobe which is responsible for balance, and also for eye movements. Right? So the vestibular ocular reflex is used to, this is a reflex which is used to test for the integrity of the floccular nodular lobe. Rotation of the head produces a compensatory movement of the eyes. Next question, in the presence of vasopressin, the greatest fraction of filtered water is reabsorbed from. Now this is a slightly tricky question, but you must understand. Now 62/3 of the water is absorbed from the PCT, and this is irrespective of the presence of ADH. ADH only controls about 13 to 15% of the water absorption from the collecting duct, right? So even if ADH controls the water absorption only from the collecting duct, what happens in the proximal tubule is 2/3 of the water, or 66% of the water, is going to be absorbed, and this is called an obligatory absorption. That means this will, obligatory reabsorption of water, that means this will happen whether ADH is present or not, right? So now in presence of vasopressin, the greatest fraction of filtered water is always absorbed from the PCT, right? So this will be the answer to this question will be the PCT, right? The next question, let's have a look at the next question. This says skeletal muscle contraction ends when? How does a skeletal muscle contraction occur? Skeletal muscle contraction ends when? Now, how does the skeletal muscle contraction start? What is the trigger for muscle contraction? What is the trigger for muscle contraction? Now, trigger for muscle contraction is the availability of calcium. So how does the relaxation happen? Relaxation will be by removal of sarcoplasmic calcium, right? By removal of sarcoplasmic calcium. Trigger for muscle contraction, availability of calcium, and like I said, relaxation is done by removal of sarcoplasmic calcium. So my best answer here becomes A. Ions move out of the cytoplasm. Next, a 36-year-old male experiences symptoms of tachycardia, palpitations, and irregular heartbeat, particularly at night. His plasma catecholamine levels are found to be increased, which may result from which of the following, right? An increase in blood pressure. See, what will cause increase in the level of catecholamines? That means increase in level of catecholamines is anything which increases the sympathetic discharge, right? Increase in sympathetic discharge. Now, increase in sympathetic discharge will be seen if there is a fall in blood pressure, or if there is a fall in blood volume, or if there is a fall in blood glucose. But an increase in plasma cortisol can result in an increase in the catecholamine levels, right? Plasma cortisol will increase the catecholamine levels, right? This increased blood pressure, like I said, what are the conditions? When does catecholamine levels increase? If there is, like I said, a decrease in blood pressure, decrease in blood volume, hypoglycemia, these will result in an increased sympathetic, increased catecholamine. Right? So increase in blood pressure, increase in blood volume, increase in blood glucose cannot cause increase in catecholamine level, but a plasma cortisol level will cause increase in the catecholamine secretion. Next, Golgi tendon organ conveys message to the CNS depends upon the muscle tension. Golgi tendon organ is a receptor for muscle tension, whereas the muscle spindle is a receptor for muscle length. What is the stimulus for the Golgi tendon organ? Like I said, is the increase in muscle tension. Which are the afferent fibers from the Golgi tendon organ? This is 1B. What is the center for the Golgi tendon reflex, or which is also called the inverse stretch reflex, which is the spinal cord? Efferent. Efferent is the A alpha. What is the response which is going to be seen? There is a muscle relaxation. Whenever the Golgi tendon organ is stimulated, it produces a muscle relaxation. And the name of the reflex is an inverse stretch reflex. It gives rise to what is known as the inverse stretch reflex. How many synapses are there? Number of synapses. Number of synapses are 2. It is a bisynaptic reflex. Let's have a look at the next question. Total alveolar ventilation. What is total alveolar ventilation? Now, what is alveolar ventilation? Alveolar ventilation is, this is tidal volume. This is the tidal volume minus the dead space volume into the respiratory rate. Tidal volume minus the dead space. So you take tidal volume as 500, dead space volume as 150 into, let's say, a respiratory rate of 12. This gives you 350 into 12, which is approximately 4.2 liters per minute. Right? So this is as far as your answer becomes 4.2 liters per minute. What is pulmonary ventilation? What is pulmonary, or the total pulmonary ventilation? This is going to be the respiratory rate into tidal volume, and that is 12 into 500, and which is 6 liters per minute. 6 liters per minute. This is your pulmonary ventilation. Next, let's see Greatest stimulator for ADH secretion. Which is the greatest stimulator for ADH secretion? Increase in plasma osmolality. Increase in plasma osmolality. This is the most important stimulus for the ADH secretion. Whenever there is an increase in plasma osmolality, this stimulates the osmoreceptors. Which are the osmoreceptors? This is the OVLT area in the anterior hypothalamus. What is OVLT? Organum vasculosum of lamina terminalis. It stimulates the osmoreceptors, which in turn sends impulses to the supraoptic nucleus. And what is secreted from the supraoptic nucleus is ADH. There is going to be an increase in ADH secretion. Most important is increase in plasma osmolality.